Welcome to part 2 of 3 of the Adaptive Mentorship for Dietetic Practice Training videos. This segment will focus on the adaptive response, or the A grid. In this slide, you'll see the preceptor's adaptive grid, or it's known as the A grid. The grid is laid out the same as the student D grid. The levels of task and support are inverse the student's level of competence and confidence. As a preceptor, your role is to mentor using an adaptive response. When the student indicates where he or she is on the D level grid, then you try and match the needed levels of task and support. If the student has indicated they are at a D1 of low competence and high confidence, then the preceptor responds with high task, so lots of telling, direction, and demonstrating, and low support because the student does not feel they require the support at this time. The focus of the preceptor is to demonstrate skills. The student has indicated they are a D2, low competence and low confidence. The preceptor then responds with high task, so doing lots of telling and demonstrating, but also providing a lot of support. So they're providing feedback, noticing when the students are doing well, etc. The student has indicated they are a D3, so both high competence but low confidence. The preceptor responds with low task, so less demonstrating and telling, but continuing to offer support in an effort to help the student gain confidence. A3 is a place where a preceptor can make a very big impact on the confidence level of the student. At this stage, it is easy to allow a student to go off on their own because they're highly competent, but because they're not feeling confident, this can impact decision making and could make him or her hesitate as a professional. As a D3, they may be nervous in front of other healthcare professionals, feel nervous to demonstrate their knowledge and skills. This will require the preceptor to provide lots of positive feedback to boost the confidence. In this scenario, the student has indicated they are a D4, so they're both highly competent and highly confident. The preceptor responds with low task and low support in this scenario. It is important to remember that low task and low support doesn't mean no task and no support, because it can be tempting when you're really busy to allow a highly confident and competent student to go off on their own. However, they will still need some feedback and opportunities to discuss and reflect how they're doing. The next segment will focus on application of the adaptive mentorship model.
Created using Powtoon.